Hi, my name is Mr. Benji, Cultural Ambassador and lead singer for TK International. Covid-19 has hit my livelihood very hard. No large crowds means no shows. No live performances means no zero. I want to get back to doing what I love, to what you love. Let's get back to 13. I can only get back on stage if we all take the vaccine. Get vaxxed. Mr. Benji said so.
I did not imagine that the prayers of my country would have been answered so swiftly.
Vaccine. Under COVID pressure in we country, mentally, socially, economically. Look, we get a blessing rather quickly to bring us back to some kind of normalcy. Yes, you over 18. Take the vaccine to protect your family. Take the vaccine to safeguard the elderly. Take the vaccine to bring back with festivals. Take the vaccine. Take the vaccine. Take it. Take the vaccine. Need it. Take the vaccine. Take it. Take the vaccine. Need it.
This is a message from Tasha P. and the Health Promotion Unit of the Ministry of Health, Dominica.
Hi everyone, I'm Nadia Farrell Peanut, Head of the Adult Education Division.
Hi, my name is Ms. Roach. I'm the Minister Secretary for Ministry of Governance.
Hi, I'm Consuelo Warrington, Administrative Assistant at the Establishment Personnel and Training Department.
Hi, I'm Shamin Thomas from the Ministry of Governance.
Hi, I'm Bruna John Baptiste, Senior Clerk, Establishment Personnel and Training Department.
Hi, I'm Emmeline Augustine, Establishment. Just wanted to know that
I got vaccinated.
I got vaxxed.
I got vaccinated. I got vaccinated.
I got vaccinated.
I got vaxxed.
And I encourage you to get vaccinated.
Take the vaccine. Take it. Take the vaccine. Need it.
Good evening, ladies and gentlemen, Dominicans here and in the diaspora. It's a pleasure to welcome you to this COVID-19 update. This evening, we aim to bring you information on home isolation protocols and the vaccination campaign, including the rollout of the Pfizer vaccine here in Dominica, and we aim to address as many of your concerns as possible. And so we're happy to have with us this evening the Chief Medical Officer, Dr. David Johnson, and the National Coordinator of the Home Isolation Program, and also the mobile testing teams, Dr. Gilda Nesty-Tong, who will begin this evening's press briefing.
Chief Medical Officer, Dr. David Johnson. Communications Specialist in the Ministry of Health, Wellness and New Health Investment, Ms. Sheena Harry. Ladies and gentlemen, good evening. A few weeks ago, the mobile team of the Home Isolation Unit responded to a distress call from one of the primary healthcare nurses in one of our districts. The nurse had been called that morning by a frantic female, practically in tears, indicating that her mother, who is an elder and a shut-in, had a cough and a mild fever throughout the week. She continued that on that particular morning, her mother was not doing well and appeared to be gasping for breath. The district nurse reached out immediately and the mobile team responded within 30 minutes. On arrival, we ensured that we were properly dressed in our protective wear, head covers, mask, face shields, gowns, gloves, and shoe covers. One of the community health aides who work with the team ensured that all details and demographics of the entire household was properly documented. We were ready to face whatever lay ahead. On arrival into the home, 4 other family members were met. 2 were distracted by their phones, and 2 had mild symptoms of cough and runny nose. We responded first to the elder in her room. Upon entry into her room, what was witnessed was nothing short of heartbreaking. On what appeared to be a full-size bed with pink sheets adorned with beautiful poinsettias in an immaculately kept room lay a tiny frame that almost appeared lifeless. Her breathing was labored, filled with the sound of air moving over mucus and accompanied with what we describe as an audible wheeze. There was a visible rise and fall of her chest wall, but with every breath, the muscles of her neck would stretch like an elastic band. Although appearing peaceful, she was obviously distressed, as it took her immense effort to even respond to a simple name call. Maybe in her mind she had given up. Considering this, a battle failed. Of course, we moved in record speed and conducted a rapid COVID-19 antigen test on her, while instructing the accompanying nurse to call upon the COVID ambulance at once. Her results were not yet available. However, we could sense the inevitable. All family members were tested, and we painfully awaited the 15-minute recommended time interval to determine the results. However, from the moment we dropped the elder lady's sample onto the testing disk, her positive results illuminated, confirming that the COVID virus had indeed visited this home. All family members were unvaccinated, and they explained that they refused to vaccinate their mother because of all that was read from the internet. They continued to explain that their mother doesn't leave the house, so they had no idea how she could have contracted the disease. They continued to also explain that they all had a mild flu, but their symptoms had improved, and they were just monitoring their mother, as they expected her to feel better too. The results of 2 of the family members indicated a faint line of positivity, and the other 2, still glued to their phones, were negative. While listening to the myriad of excuses that followed, with the smell of death in the air, the COVID-19 ambulance arrived, and the elder mother, along with her 2 positive children, was swiftly taken to the COVID isolation unit in Portsmouth. Word was received the following day that their mother had died. 2 days later, via the COVID hotline, a concerned neighbor called to express that there was a family of 4 who lived next door, and that her elder friend, the grandmother in the home, had a loud cough, especially heard at night. The message forwarded to the mobile unit was that there was need for urgent testing of that family, and members refused to get tested at the stadium. The mobile unit responded and, dressed in PPE, went to the home of concern. About 10 minutes was spent calling on family members, asking permission to conduct testing. It took the team 10 minutes to get a response in a home where we could hear footsteps and the cry of a young child. 3 of the family members eventually surfaced: a young mother and her daughter and their grandmother. We asked for the 4th family member and was told that he had gone off to his garden in the bush. We conducted the usual questioning, accumulating the data that we required. Both adults were unvaccinated and denied symptoms. While changing our gloves to conduct the actual testing, the grandmother began to cough, and a loud, powerful, wet cough with a crackling, reverberating sound was heard. Her coughing went on for about 30 seconds, with her gasping for breath in between. She lowered her mask to cough, causing us to both make an emergent 360-degree turn. With her mask off, she explained that she has a little flu, and she's drinking her bush to treat it. We pleaded with her to put her mask back on, ensuring her nose and mouth was properly covered. When we lowered the mask of the 6-year-old girl, mucus was seen running down her nose, and evidence of an earlier runny nose was kicked along her cheeks. The family still continued to explain that their symptoms were related to a mild passing cold. On completion of the testing time, all 3 family members had a positive result. While removing our soiled PPEs and preparing to move on to our next testing site, the fourth family member emerged, asking that he please be tested. A terrible inconvenience it was. However, of course, we complied. And as expected, he too was positive. All four family members were transported to the COVID isolation unit and are currently doing very well. Ladies and gentlemen, these scenarios are a common, everyday occurrence for the mobile team of the home isolation unit. We continue to witness the consequences of the poor decisions made by our unvaccinated youth. It is also evident by the vast number of elder patients currently admitted to the COVID-19 government quarantine facilities. We continue to witness the effects of those who insist on not adhering to the protocols of the Ministry of Health. The threat of difficult ramifications is most certainly real. The further reality is the freedoms we enjoy or once enjoyed are not available to us at this time. Besides practicing all necessary COVID-19 recommendations, one must keep in mind that one of our greatest weapons is indeed the COVID-19 vaccine. While becoming vaccinated is not mandatory, unvaccinated persons still do not have the right to risk the safety of the healthcare system, our personal lives, or the lives of the most vulnerable. For those of you with valid fears or concerns, engage your doctors and seek their counsel. Allow us to better assist you in putting an end to your concerns and ultimately this pandemic. Also, on behalf of those of us who diligently avoid large crowds, who have joined the fight against COVID by becoming vaccinated, we ask that you at least be considerate enough to not put innocent lives at risk. We at the Ministry of Health continue to reiterate that if you are experiencing flu-like symptoms, cough, cold, runny nose, fever, unexplained vomiting and diarrhea, be mindful that there is a great possibility that you could be infected with the COVID-19 virus. If there are vulnerable persons in the home, such as elders, babies, or adults with underlying illnesses, please exercise all precautions in their presence. If you are experiencing flu-like symptoms, wear your mask at all times in the home. Wash your hands and get to know your status. But above all, get vaccinated as soon as you can. Thank you.
Our thanks to Dr. Gilda Nesty Tong, again the National Coordinator of the Home Isolation Program and the Mobile Testing Teams. And of course, she provided a very good segue into our next presenter, who is the Chief Medical Officer, Dr. David Johnson.
Thank you very much, Ms. Harry, our moderator. Dr. Hilda Nesty Tong, our coordinator of the Home Isolation Program. Ms. Harry, our moderator. To you, the listening and viewing audience, good evening. Prior to August 1st, 2021, we had only 218 confirmed COVID-19 cases in Dominica and no deaths. We have seen the surge in cases from the beginning of August 1st, 2021, and we did confirm that that was attributable to the circulation of the highly transmissible Delta variant. Although out of the 3,416 confirmed COVID cases that we have seen so far since the first case in March 2020, 2,000 823 of these cases have successfully recovered. We think that some of the 20 COVID-related deaths could have been avoided if these patients were fully vaccinated. We continue to see roughly 71% of positive COVID patients are unvaccinated. And of those who are symptomatic, 75% of the patients are unvaccinated. We will continue to pursue a very aggressive vaccination campaign because we know it is a responsible thing to do, and we know it is the right thing to do. We are very excited that in Dominica we have 3 vaccines to help in the fight against the COVID-19 pandemic. These are namely the Sinopharm, the AstraZeneca, and the Pfizer vaccine, all of which have been approved by WHO for emergency use listing. It is indeed remarkable that we have these vaccines that are available at absolutely no cost to anyone who wants the vaccine. All you have to do is make yourself available for the vaccine, which are available throughout the entire length and breadth of Dominica, and choose the vaccine that you want. There is absolutely no lack of scientific evidence that the vaccines that have been approved for emergency use listing by the World Health Organization are highly effective in preventing severe diseases, reducing hospitalization and death from the COVID-19 disease. We have been preparing and waiting for the Pfizer vaccine, which was donated by the US government. And we have it now. So let me say a few things about the Pfizer vaccine. We have started to roll out the Pfizer vaccine a week ago, on September 23rd, to be precise. So who should get vaccinated with that vaccine? In Dominica, we're giving the Pfizer vaccine to children 12 years and above, and any adult who wants the Pfizer vaccine. Children 12 years and above, and any adult who wants the vaccine. Who should not get the vaccine? Well, if you have a severe allergic reaction or an immediate allergic reaction to, even if these were not severe, to an ingredient in what we refer to as the mRNA COVID vaccine, but we think there are a few persons in Dominica who have already done that. If you have a severe immediate allergic reaction, after getting the first dose of the vaccine, an immediate allergic reaction means a reaction within 4 hours of exposure, including symptoms such as the bumps that you might get on your skin, or hives, swelling, or wheezing, and respiratory distress. Let me say at this stage that the Pfizer vaccine does not contain eggs, no latex in that vaccine, no metals, and it has no chip in it. However, before administering the vaccine, the individuals are screened for contraindications and precautions, even if the individual is scheduled to receive his or her second dose. We recognize that individuals' health condition regarding contraindication and precaution for vaccination may change from one visit to the next, so we take time, or healthcare providers take time to go through the screening process. The standard pre-registration checklist is being used for doing so. The Ministry of Health is working very closely with the Ministry of Education to get school children vaccinated. We are reaching out to the parents and guardians of students to fill out the pre-registration form and ultimately getting their consent for their children to be vaccinated. It is not mandatory for now. We have set up vaccination sites at selected schools and several other locations around the island. Vaccination rollout is occurring simultaneously throughout the entire island. We are seeking to give appointments per class so as to limit the number of students and parents at any particular location at any one time. But I should say, even if you don't have an appointment and you take your child for the vaccine, it will be administered to the child. So it's not only by appointment. If you show up with your child and say, I want to get vaccinated, your child will be vaccinated after going through the screening process. In some cases, we have 2 or 3 teams per vaccination site so that there can be more than one vaccination station per school at one time. Although we are used to administering vaccine to thousands and thousands of children for many decades and decades in Dominica, during the early days of the Pfizer vaccine rollout, we are ensuring that a medical doctor and or a family nurse practitioner are available on site just as an added precaution for these children. 2 Pfizer vaccine, or 2 doses rather, I should say, of Pfizer vaccine will be administered for each client separately at a minimum of 21 to 28 days between the first and second dose. As of yesterday, the 28th of September 2001, we have administered 531 first dose to children 12 years and above, and 738 first dose to adults. So that gives us over 1,200 doses. We are working to get to a target of 7,495 children, which are between the ages of 12 to 17 years, so that they could be vaccinated. In terms of our vaccination campaign in general, the rest of the population, 18 years and over, it's around 47,000. We have administered so far 24,314 first dose, and second dose just over 21,327. And we are just about 46% of our eligible adult population receive the second dose. For us in Dominica, we are not interchanging vaccines for now. In other words, we give the first and second dose using the same type of vaccine to complete the vaccination series. We have vaccinated patients with diabetes, hypertension, stroke, asthma, heart disease, cancer, HIV, bleeding disorders. I do admit that some persons do have genuine concerns about the vaccine. Persons do have genuine concerns about the side effects. Persons think that the vaccines were developed too fast, although there's a lot of evidence to show that the vaccine was being developed for a long time now, over 10 years, since you have different families of the SARS virus. Persons don't trust the manufacturers. Persons don't think that the vaccine will protect them. Persons think that they cannot get the COVID disease. In Dominica, we have a surveillance and monitoring system to monitor adverse events related to vaccine. Everyone who receives a COVID-19 vaccine is encouraged to report any adverse effect following vaccination to the healthcare provider or to the COVID-19 health hotline. The vaccine management system that we have developed or we have established is linked to a system that we have in place for a very long time, which is referred to as the National Public Health and Response Surveillance System, which was established since 2003. And we have our communicable disease surveillance and infection control officers are actively following up with all the health districts and hospitals to determine if anyone has reported any adverse effect from these vaccines. There has been no reports of any severe side effects from these vaccines, and no one has died from these vaccines. So where some persons have genuine concerns with the vaccine, I've mentioned before, there are some persons who know to the heart of heart that they're spreading conspiracy of pandemic about the vaccine. A conspiracy of pandemic, we refer to it. Well, they have their conscience and to God to answer to, and to the many persons who otherwise could have survived the COVID-19 had they not believed in the conspiracies that they spread. Everyone knows that COVID-19 is real. I don't think there's anyone who doesn't know that or don't believe genuinely that the COVID-19 pandemic is real. It has resulted in loss of freedom and some of the things that we once enjoyed, financial hardship. There are long-term health complications, and there is death, which we all are familiar with. So I have some concerns too in my capacity as Chief Medical Officer of Dominica. I am deeply concerned, as you've heard before. I am deeply concerned for frontline workers who are exhausted and going beyond the call of duty at great personal sacrifice and that of their families and loved ones. Not resting, reaching burnout point to save lives and bring the situation back under control. I'm also concerned of the high percentage of unvaccinated persons in Dominica. And I am, as our coordinator of home isolation indicated earlier, I am deeply concerned about our elderlies who are not on the streets partying and socializing, but are bearing the brunt of this current surge and are dying. I am deeply concerned. Before I end, I want to take this opportunity to express profound gratitude and thanks to the many frontline workers who are part of the Army in the fight against the COVID-19 pandemic. You always run the risk, so one runs the risk of leaving out persons when you start listing individuals, but I would like to express thanks to the Vaccination Rollout Unit, the staff of the COVID Care Complex in Portsmouth, our staff at the Dominica China Friendship Hospital, and our staff at Primary Health Care Services and the Home Isolation Program. Getting back to normal, or getting to the new normal, we have to continue. For now, mask wearing, proper hand hygiene, proper cough etiquette, physical distancing. But the COVID-19 vaccine are our best shot at beating this pandemic and getting back to normal. So let us act responsibly. And just as how we are all proud to say, I am Dominican, let us all be proud to get vaccinated. And after you have gotten vaccinated, tell yourself that I am going to get at least 2 other persons, a family member or friend, to get vaccinated. I really want to thank you for your attention, and do have a blessed evening.
Our thanks to the Chief Medical Officer, Dr. David Johnson. And as you heard from Dr. Johnson, our numbers continue to rise. The deaths in Dominica, unfortunately, continue to rise. And let me at this point just express my deepest sympathies and condolences to all those who have lost a loved one due to this COVID-19 pandemic. Ladies and gentlemen, you have heard it over and over again, our best line of defense is to get vaccinated. You have questions, get the answers from credible sources. Your doctor may be your friend. Your district nurse may be your friend. Ask them the tough questions. They're willing to answer. But if you don't get vaccinated for yourself, do it for the vulnerable in your family. Do it for the people you care about. Do it for the very healthcare workers who are your friends and who are working tirelessly. Don't forget that vaccination is available at all the Type 3 health centers. We also do vaccination at the Windsor Park Sports Stadium. If you're unsure, call your nurse and ask her, where can I get vaccinated? We thank you, as always, for your kind attention. We thank our media partners and, of course, the Office of the Prime Minister for hosting us. And we ask you, we urge you to do what is necessary to protect yourself and to protect your family. Good evening.